Good afternoon. Thank you all for joining us for today's presentation for healthcare providers who want to learn more about becoming board authorized to treat workers' compensation patients. I'm Adam Rossi from the Communication and Outreach Unit at the Workers' Compensation Board. And with increases to medical fee schedules and the adoption of the CMS-1500 Universal Medical Billing Form, treating patients in New York State workers' compensation is now more in line with mainstream healthcare than ever before. However, there are some things that set providers treating workers' compensation patients apart, and that's what we're going to review today. Joining me are Dr. James Tachi, the board's medical director, as well as Paula Rauch, Christopher Failing, and Eileen Moss from our medical director's office, and they will be on hand today to answer any questions you may have. You can ask your questions throughout the presentation in the chat box, but please note we will be holding off until the end of the presentation to answer any questions you may have. Again, the chat box should be located on the right side of your screen. Just use the drop down to send your questions to all panelists, and we will answer as many of your questions as we can. But if you have questions that we either don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. So, as mentioned, there are a few things that set providers treating workers' compensations apart, and that's what we'll be discussing today. The board has made great strides over the last few years in terms of streamlining our systems and reducing the amount of paperwork, making it easier than ever to be part of the workers' compensation system. We hope to encourage not yet authorized providers like you to become board authorized. More treating providers means New York's injured workers have more options and better access to quality health care. Let's take a look at our agenda for today. We'll start with a note about the expanded provider law. Following that, we will discuss the various disciplines and review what each can and can't do. Next, we will review the basic overview of the New York State Workers' Compensation fee schedules and the New York Medical Treatment Guidelines, known as MTGs. We will then take a look at some of the improvements the board has made to its systems that make it easier than ever for healthcare providers to treat injured workers. We will also review the 3 musts when filling out most medical narrative reports. And then lastly, we will also touch base on a telehealth regulations. And finally, again, we will conclude with how you can apply to become board authorized, and then we will leave time at the end to take your questions. So we'd like to start with sharing some background on the expanded provider law. As part of the 2019-2020 budget, a law was passed expanding the types of medical providers that can be authorized to treat injured workers in the New York State workers' compensation system, including licensed clinical social workers, nurse practitioners, acupuncturists, physician assistants, occupational therapists, and physical therapists. Since the expanded provider law was implemented on January 1st of 2020, an influx of more than 22,000 healthcare provider applications have been processed to date. Currently, the board processes up to 250 applications per month, 50% of which come from new expanded provider types. And the board is always on hand to help, as we do respond to approximately 400 calls, emails, and letters each week. All providers who can be authorized by the board to treat injured workers must be board authorized to continue treating injured workers. Becoming a board authorized healthcare provider will allow you to treat and bill for workers' compensation services. The board has developed a chart that specifies what board authorized providers can do within the New York State workers' compensation system. To view this chart, visit wcb.ny.gov and click on the Healthcare Provider page. From there, you can scroll down to the Provider Resources section and select Expanded Provider Law. You can scroll to the Resources section to access the Who Can Do What chart, which is shown here on your screen. Please note, certain urgent care, emergency room, out-of-state, and durable medical equipment healthcare providers are not required, and some are not eligible, to be board authorized to treat injured workers. And again, that website, you can find it, is wcb.ny.gov, and is on the healthcare provider page. Following providers are not eligible for board authorization, but they can treat injured workers and submit for assistance with disputed bills. Audiologists, dentists, optometrists, durable medical equipment suppliers, laboratories, pharmacies, and speech pathologists. The following providers cannot treat injured workers: massage therapists, occupational therapy assistants, or physical therapy assistants. One of the actions the board has taken to improve the workers' compensation system for providers, and hopefully encourage more to participate, is to implement a new fee schedules with higher reimbursement rates for all provider types, as well as additional increases for certain specialty provider groups. For example, recognizing the need for more behavioral health providers, the board implemented a 20% increase for designated behavioral health services. More information for each fee schedule is available on the provider section at the board's website at wcb.ny.gov. Another area of improvement for the board has been the updated New York Medical Treatment Guidelines, or MTGs. First, a little bit of background. In December of 2010, the board implemented legislatively mandated MTGs that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. On March 1st of 2013, the carpal tunnel syndrome MTG and updated versions of the then existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The full list of MTGs effective for treatment as of May 2nd of 2022 are listed here on your screen. You can read more about the MTGs in the treatment section of the provider page at wcb.ny.gov. In order to assist healthcare providers with learning the ins and outs of the MTGs, the board has created MTG trainings. You will also find links to MTG trainings currently available for medical and non-medical professionals. We want to note that as of December 29th of 2022, these programs are temporarily unavailable for CME credit, but they are expected to resume soon. The board will announce when the courses for CME credit become available again, so please watch for an update on that, and we will let you know how you can get signed up for email updates and make sure you're aware of that later on in the presentation. The non-credit bearing courses, however, are still available. To access the trainings, visit the board's website and navigate to the healthcare provider section in the middle of the homepage. Select the medical treatment guidelines link. And from there, select the training link, which is on the right side of the page. You can access full details on these new and updated MTGs, including a PDF of the respective MTGs, on the board's website at wcb.ny.gov. Select Providers at the top of the homepage, scroll down to Resources, and then select Medical Treatment Guidelines under the Treatment section. We also have an MTG Lookup Tool in the medical portal. The MTG Lookup Tool allows users to quickly determine whether a particular condition or a treatment test combination is recommended, not recommended, or conditional according to the MTGs. When a treatment name is selected, the relevant section of the full MTGs for that condition will display. This online tool will help speed treatment decisions and ultimately provide more effective and efficient care for injured workers. The MTG Lookup Tool also has a feature for use by providers that produces a verification summary document in PDF form that confirms a lookup was completed, provides treatment recommendations for that condition, and displays patient-specific case information. This document can be kept by the healthcare provider or attached to any request for service or medical bill being sent to an insurer as verification that the treatment adheres to the recommendations set forth in the MTGs. The MTG Lookup Tool is available for all the MTGs, and to access the medical portal and the Lookup Tool, visit the board's website, again, wcb.ny.gov, select Medical Portal from the Online Service menu at the top of the homepage. The board has been working hard over the last few years on two major initiatives to streamline processes and reduce paperwork in the workers' compensation system. The implementation of the CMS-1500 form is one of those initiatives. Providers had previously indicated that the unique paperwork requirements in the New York State workers' compensation system were time-consuming and cumbersome to complete. So to reduce the administrative burden on board-authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS-1500 form, which is the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services, CMS, as well as health insurers. The CMS-1500 initiative applies to medical bills for professional services as well as durable medical equipment items. It does not apply to institutional or pharmacy billing, although non-network pharmacies may continue to bill using the CMS-1500 form. As of July 1st of 2022, providers must submit the CMS-1500 form. Electronic submission through an XML submission partner is strongly encouraged. As part of the initiative, use of the prior medical billing reports, including the doctor's initial report, Form C4, and the doctor's progress report, Form C4.2, have been discontinued. Full listing of discontinued forms will be discussed later in this presentation. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS-1500 form medical narrative. Payers are required to use the new Notice of Treatment Issue or Disputed Bill, Form C8.1B, and Notice to Healthcare Provider an injured worker of a carrier's refusal to pay all or a portion of a medical bill due to valuation objections, which is Form C8.4, with applicable claims adjustment reason codes, or CARCs, to object to medical bills. Workers' compensation payers will electronically transmit the EOBs and EORs to their XML submission partner upon adjudication of the associated electronic CMS-1500 medical bills. Payers are also required to use specific CARCs on their provider EOBs and EORs when objecting to a payment of a medical bill, whether the bills are received through an XML submission partner or on paper. Again, once you become authorized to treat injured workers, you are encouraged to sign up for the medical portal so you may take advantage of all the online services the board offers, including preparing for electronic submission of medical bills to payers and the board. Once you have accepted the terms of XML submission agreement, you can then discuss the details of submission with an approved XML submission partner, also known as a clearinghouse. We have received a number of questions about submitting the CMS 1500 form electronically. Here are a couple things you need to know. Electronic submission of medical bills by the healthcare providers through an XML submission partner is strongly encouraged but not required. When providers submit CMS-1500 forms electronically through an XML submission partner, the XML submission partner will submit the forms to both the carrier and the board. Most medical billing software vendors partner with one or more XML submission partners. Please contact CMS-1500 at wcb.ny.gov for assistance determining which XML submission partner may fit best with your systems. We'd like to take a minute to highlight the many benefits of electronic submission. Providers receive confirmation within 7 days that their bill was accepted or rejected by the payer. Providers typically get paid quicker. With acknowledgement of receipt from the payer, the provider is aware that they should not resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the payer to deny the bill. For more information, visit wcb.ny.gov/CMS-1500 or email cms1500@wcb.ny.gov. In March of 2022, the board was pleased to launch one of its most significant initiatives to date, our new and improved business information system Onboard, which offers stakeholders, including healthcare providers, a much easier and more efficient way of interacting with the board. The goal of the Onboard program is to replace our multiple legacy paper-based claims system with a single web-based platform. Stakeholders are currently experiencing several major benefits with the new Onboard system, but because building a new integrated system from the ground up takes time, we've kicked this initiative off with some high priority processes that benefit from moving online through an early version for payers and healthcare providers, which we call Onboard Limited Release. Now, payers and providers are using Onboard to request and review prior authorization requests, known as PARs, process for medication, durable medical equipment, and medical treatment testing, as well as the submission of the Request for Decision of Unpaid Medical Bills, Form HP 1.0. After a successful launch, we now have hundreds of these PARs successfully flowing through our system each day. More than 48,000 healthcare providers have registered for Onboard, and more than 31,000 delegates have been added. Since Onboard launched on March 7th of 2022, more than 615,000 PARs have been filed. On the successful implementation of Onboard Limited Release, preparations for the Onboard full program are underway, and we encourage you to stay tuned for more updates on that. Once you become authorized to treat injured workers, we strongly encourage you to sign up for Onboard as soon as possible. Healthcare providers must use the medical portal to access Onboard or to apply for or renew an authorization. The updated medical portal section of the board's website contains full details and information you need regarding how to register and get an ny.gov user ID and password to access Onboard and to grant access to others to act as your delegate. Visit the provider section at wcb.ny.gov/onboard for a guide on registration. Assigning delegates, such as your office support staff, can assist you by drafting PARs, which must be reviewed and submitted by the healthcare provider. Drafting escalations to Level 2 medication PARs, which must be reviewed and submitted by the healthcare provider. Drafting PAR escalations to Level 3 for medical director's office review and submitted by the healthcare provider to be reviewed. Responding to insurer requests for information. Drafting and submitting Form HP 1.0. Visit the link on this slide to view a registration guide for healthcare providers. We would like to know, however, that delegates cannot do the following. They cannot accept the XML submission partner agreement, register with the medical portal, or report on a provider's status. The board has also developed a chart that outlines what submissions certain authorized provider types can make. You can view this chart on the provider overview page at wcb.ny.gov/onboard. And I just want to note this is a different chart from the one we mentioned earlier that Dr. Tachi has provided you with the link to in the chat box that you'll see. This is for who can submit what in onboard. Once you become a provider who is authorized to treat injured workers, you play an important role in making sure that injured workers receive the benefits they are entitled to. And we want to ensure you are paid promptly by the insurer as well. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies most provider submissions of the CMS-1500 form. The template includes the 3 elements to include with most narratives. They are the patient's work status, causal relationship of the injury or illness to the patient's work activities, and the temporary impairment percentage. Again, we want to stress that this is important to include these 3 elements to ensure that workers receive the treatment and indemnity benefits that they are entitled to, and so you, as the provider, can be promptly paid. Additionally, a medical narrative report may be found legally defective if these elements are missing. A PDF of the report can be found at wcb.ny.gov/CMS-1500/requirements under the Medical Narrative Requirements section. For certain types of medical services or supplies, a medical narrative is not applicable. Instead, an attachment is required. So, for example, a radiologist should submit the radiological report with the CMS-1500, and a DME supplier should submit the physician order with their bill. A full list of attachment examples may also be found on the requirements section of the website. The chart shown here shows the 3 elements providers should include when submitting most medical narrative reports according to their specialty. You can view this chart at wcb.ny.gov/CMS-1500/requirements. Please note, a record, report, or opinion of a physical therapist, occupational therapist, acupuncturist, or physician assistant shall not be considered as evidence of the causal relationship of any condition to a work-related accident or occupational disease. Nor may a record, report, or opinion of a physician assistant be considered evidence of the presence of a permanent or initial disability or the degree thereof. When the medical narrative template is used, providers must attach a narrative report with clinic visit history examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, the diagnosis and assessment of the patient, and a plan of care. Emergency telehealth regulations have been in place since March 16th of 2020 to allow telemedicine in some circumstances for social distancing purposes due to COVID-19. These regulations were extended in October 2022, and we anticipate that in response to prior public comments, future permanent telehealth regulations will be forthcoming. You can stay informed on the latest updates by visiting the provider section on the board's website. So now that you have all the details on our system, we hope that you apply. To become a board-authorized provider, please take the following steps. Step 1, sign up to use the board's medical portal and log in with the credentials that are assigned to you. The medical portal is your one-stop shop to access trainings, the MTG Lookup Tool, Drug Formulary Lookup Tool, and Onboard, as well as a link to accept the terms of XML submission agreement in order to electronically bill using a CMS-1500 form. Step 2 is to complete the required training specific to your profession. Step 3 is to complete the new provider authorization request online application. Physicians should be aware that their applications will be reviewed by a medical society who will have 45 days to process the application. All applicants are encouraged to read the instructions on applications carefully and include any required attachments. More information can be found on the provider page of the board's website by selecting Apply for Authorization under the Healthcare Providers Resources section. Physicians should particularly pay close attention to the Important Notes for Physicians section, which demonstrates how to qualify for a specialty rating. You can view a Who Can Do What chart in the medical portal on the Healthcare Provider Overview page at wcb.ny.gov/medical portal. Also, it is important to note that providers must renew their authorization every 2 or 3 years. The renewal of a provider's authorization will coincide with their New York State Education Department license registration renewal. To streamline the process, the board has transitioned to a fully electronic online renewal process through the board's medical portal. As we continue to work on implementing improvements for healthcare providers, we're committed to increased communication with providers, such as this webinar and targeted emails. The board has also created a special webpage dedicated to sharing timely updates on various board initiatives with the healthcare provider focus. Visit the board's website at wcb.ny.gov and select the Provider Updates quick link on the whole provider page. We are also committed to regular engagement regarding onboard. As primary users of the new system, your input and engagement in the project is very important. For more information on becoming a board-authorized healthcare provider, please visit wcb.ny.gov/new provider, or you can email provider@wcb.ny.gov. For more information on onboard, please visit the website at wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for providers. For more information on the CMS-1500 form, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS-1500 initiative, and that email address is cms1500@wcb.ny.gov. If you have provider-specific questions, you can call the helpline at 800-781-2362 or email mdo@wcb.ny.gov. You can also find the latest provider updates on the board's website. Visit wcb.ny.gov and select the Provider Updates quick link on the provider page. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov, select Get Notifications on the bottom of the homepage. You choose the topics you'd like to subscribe to, so we will not be inundating you with any useless information. We promise you that all information will be relevant to what you are looking for. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. I strongly encourage you to visit our YouTube page specifically, where we have dozens upon dozens of recorded webinars such as this one, as well as other tutorials on anything related to the workers' compensation system that are very, very helpful to providers. So I definitely recommend that YouTube page to you. So we hope you found this presentation helpful. We will now take the rest of your time to answer any questions you may have. I'm going to bring the slide back to our original resources. I do want to note our CMS 1500 subject matter expert was not available today. So if you have any questions regarding the CMS 1500, please shoot a message to that email address, or you can visit the website as well at wcb.ny.gov/CMS-1500. We will be providing you with a recorded version of this webinar, as well as a copy of the slide deck. Make sure you're signed up for email notifications so you are aware when those become available. And I am now going to hand it over to our subject matter experts to start answering any questions you may have. Again, enter any questions you have into the chat box. There may be some brief periods of silence as we review the questions that come in, and we will be back with you shortly. Thank you.
There's Chris Felling from the Medical Director's Office. Somebody asked if a provider needs to be credentialed with all insurance companies as a provider. The answer is no. A provider submits an application to become authorized to the board, and then the board processes the application and authorizes the provider. It is not necessary to become credentialed with each individual insurer. Somebody else asked if a licensed master social worker can become an authorized provider. The answer is no. The profession that we authorized is licensed clinical social worker.
I see someone asking for the social media handle, so I'm just going to go back to this slide real quick so you have those. You can jot them down. Again, strongly encourage you to visit the YouTube page. Lots of recorded webinars, lots of tutorials that would definitely, we definitely think help providers.
Hi, this is Paula from the Medical Director's Office. There's a question asking what is an IME. An IME is an independent medical exam. When the carrier is reviewing a request for a prior authorization, they have the opportunity to engage a provider, a physician, to take a look at the request, and it's called an independent medical exam.
This is Dr. Tachi. There's a question, how does this work for psychiatry nurse practitioners? How long does it take to be reimbursed, and what causes claims to be denied? Briefly, it works the same for psychiatry nurse practitioners as any other provider mentioned earlier in the expanded provider law. You apply for authorization and submit your credentials at the time that you apply. In terms of how long it takes to be reimbursed for services, that varies by the nature of the claim, the type of services, the carrier, etc. So there is not a specific answer to that. And then what causes claims to be denied? We could probably have spent the past 35 minutes talking about why claims are accepted and denied. That's sort of a detailed question. There may be legal reasons. A carrier may be contending that a condition was not caused by work, etc. Or there may be clinical issues. A carrier may state that they don't think the clinical intervention was clinically indicated or not consistent with the medical treatment guidelines. So there are several reasons why a claim might be denied, but those are sort of beyond the scope of today's talk. And the overwhelming majority are not, of course.
Somebody asked if a psychologist needs to have a PhD to participate. The answer is no. The psychologist, of course, has to be licensed in order to apply to become authorized, but the psychologist could hold a PhD or a PsyD degree. The requirement is that the psychologist has to be licensed.
Just to reinforce, if there's a workers' comp patient that you're seeing, you are not permitted to charge that patient. If the claim is denied by the carrier, the provider does have a disputed medical bill process that they can follow. There's more information about that on our website, which we can, it's up, it's on the screen. There we go.
There's a question that says, can you speak to the general compensation to providers for common cases? Unfortunately, as with medical billing in any system, Medicare, Medicaid, third-party health insurances, etc., the compensation varies and it depends on the types of services provided, etc. We do periodically benchmark our fee schedule among the other most common payers or systems. And I would say that the fee schedule, generally speaking, compares reasonably to the other major healthcare payment systems. i.e. Medicare, Medicaid, third-party payers, et cetera. And there's some variability depending on the type of services.
All right, that seems to be all the questions we have, so we're going to go ahead and wrap up. I do again want to thank everyone for joining us today. Thank you to everyone at the Medical Director's Office for taking the time to answer your questions. We always appreciate the participation. Before we sign off, I would like to remind you again to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox by going to our website, wcb.ny.gov. Scroll down to the bottom of the homepage and select Get WCB notifications. We do also offer these webinars on a regular basis. If you go to our website, there's a webinar page. You can see when the next one is being offered. We have webinars for unauthorized providers as well as board authorized providers. So if you like what you saw in this webinar today and you want to become board authorized, as I see a couple of people here have said they are going to do, we'd love to hear that. We'd love to see that. Once you do become board authorized, we also have webinars for board authorized providers. So we will hope to see you with those webinars as well. Lastly, we do again distribute information via social media. So please be sure to follow the board on Facebook, Twitter, Instagram, and again, that YouTube page, highly recommend it. We will be posting this webinar on our YouTube page as well as a copy of the slide deck on our website, and we'll let you know when those are available by email. So again, we hope you enjoyed today's session. We hope you have a good afternoon, and please enjoy the rest of your day. Thank you.